Before beginning, wash your hands thoroughly with soap and water. Non-sterile gloves are required during phlebotomy and intravenous cannulation. Arrange all equipment on a bedside table. Attach the tube of the butterfly needle to the vacutainer holder. Confirm that you have the required specimen tubes on hand. Position the patient supine on the stretcher. Explain the procedure to the patient. Inform him that the venipuncture may be mildly painful and enlist his cooperation in remaining still during the procedure. Place a tourniquet 5 to 10 centimeters proximal to the anticipated venipuncture site. First wrap the tourniquet around the arm, and then tuck a loop of one end of the tourniquet under the other. The tourniquet should be placed proximally enough as not to interfere with the procedure. Select an appropriate venipuncture site. Engorged veins are soft and feel spongy. In this demonstration, a dorsal hand vein was chosen. Cleanse the overlying skin with a skin cleansing agent such as chlorhexidine or povidone iodine. Do not repalpate the vein after skin preparation. Apply traction distal to the vein with the thumb of your non-dominant hand to prevent the vein from rolling during venipuncture. Place the thumb distally enough so it doesn't interfere with the proper angle of needle entry. Avoid placing too much traction on the vein, which may flatten it and make the procedure difficult. Hold the wings of the butterfly between the thumb and index finger of your dominant hand. The bevel of the needle should be facing upwards. While maintaining traction, gently yet relatively quickly insert the needle into the vessel. For superficial and small vessels, as shown here, the angle of entry will often be 15 degrees or less. Steeper angles, up to 45 degrees, may be required for deeper or larger vessels. As the needle enters, observe for a flash of blood in the tubing. The blood will only travel several centimeters up the tubing until a vacuum tube is applied. If an artery is entered during simple phlebotomy, indicated by bright red, pulsatile, continuous blood flow into the tubing, it is appropriate to obtain the blood sample before withdrawing the needle. However, if arteriopuncture occurs during intravenous cannulation, the catheter should not be advanced, and the needle should be removed immediately. While holding the needle steady with your hand, insert the specimen tubes into the vacutainer holder. The vacuum in the tubes will cause blood to fill them. Allow all tubes to fill completely. Occasionally, the vacuum in the tube will cause the vessel to collapse. In such situations, a syringe may be applied to the tubing, and gentle manual suction may allow for a successful blood draw. Once all samples are collected, release the tourniquet and remove the needle from the vessel. Apply a bandage to the site and apply direct pressure for several minutes to reduce hematoma formation. Activate any sharps protection devices on the needle and dispose of the needle in an appropriate biohazard container. Finally, apply patient identification labels to the specimen tubes and submit them to the laboratory.